It's almost a year since Charlotte Maxeke Hospital was gutted by fire, and it's still not been fully functional. Reconstruction has been slow and marred by sabotage. That the National Health Department has assumed control to fast-track this process.
We acknowledge that the progress has been quite slow and unacceptably slow, and therefore something had to change. And what we then agreed was to happen was that our infrastructure section in the National Department of Health would work very directly with the Gauteng Department of Health to make sure that we find solutions together in terms of intervening.
So I asked the Minister of Health why no one was held responsible for the seeming shift of responsibility.
I have no authority to go and say to whoever was given the task in the Department of Infrastructure in the Gauteng province to go and say, I as a Minister of Health is going to take action against you. It doesn't work that way.
Well, this exposes a serious security breach at the hospital. The theft of copper and equipment has thwarted its reopening. But nursing union Denosa claims corruption has informed that delay.
A fire only destroyed a section of the hospital, but they are failing dismally so to correct the situation. The situation is very dire as a direct consequence of the closure of Charlotte Maxeke. Particularly if you go towards the Johannesburg area, your South Joburg, your Bara is currently struggling because it's feeling the impact of the closure of Charlotte Maxeke, Helen Joseph, Rahima Musa, but also the hospitals in Ekurhuleni are also suffering. The closure of that hospital remains a challenge, and it will continue to have an impact on the quality of healthcare services that are provided. So the situation is dire. I mean, if you go to Helen Joseph, some patients are being treated on a stretcher. If you go to the same Bara as well, the shortage of food, because the hospital now has got a more added bed capacity.
Recently, Chris Hani Baragwanath Hospital's food supply was also compromised. There was a shortage of bread, resulting in medical staff protesting over the situation.
I also hold Premier David Makura accountable. He said 8 years ago, when he first became Premier, that he's going to urgently turn around the Gauteng Health Department. Well, 8 years later, it's just as bad as ever. I would have thought that after Life Esidimeni, after the PPE corruption scandal, things would be set right, but we just get more and more scandal. And I mean, it's just shocking that they have to hand over Charlotte Maxeke Johannesburg Hospital to the National Health Department because they're unable to fix it. That alone is causing a terrible crisis in which patients are suffering. Now we hear that the Accident Emergency Department of Charlotte Maxeke Johannesburg Hospital won't open possibly until mid-April.
So it's clear that people's tax rands are not equitable with the quality of public service. Poor institutional management has a drop-down effect, affecting the poorest of the poor. So unless there's a determined will to fix it, hospitals like Charlotte Maxeke and Chris Hani Baragwanath Hospital will remain in intensive care. Chris Lewis, SABC News in Johannesburg.